Good afternoon, everyone. I'll be talking about some of our partnerships, and actually it's wonderful actually being able to follow both David and Richard, because the kind of work we're doing is open, both the open software, but also open content. And so all of the kinds of things that Richard just described actually is possible on our platform, but I didn't have time to be able to show you all of the capability. But if you keep all the things in mind that Richard described and think about it on this system, I think it'll be a good match. So I wanted to describe some of our education and training partnerships with colleagues in India and Africa that I believe are really resulting in the opportunity for truly transformative education and training. And you got a glimpse of that in listening to David and Richard in terms of the ability for faculty and students across our institutions to be sharing these materials. Why are we all creating our own? And so we firmly believe that we can work with our global partners and build local capacity, because even though we can share these resources across our institutions, it's all about taking care of our patients locally. And so what we find as we work with partners, whether it's in the United States or in other parts of the world, the faculty, yes, we can borrow anatomy, we can borrow procedures, these are things that are very much in common. But then there are local diseases, there are local variations, and so the faculty still want to be able to customize. And so what I'm going to be describing is that ability to do both, to share globally, but also to customize things locally. So I wanted to start by focusing on our partnership with Christian Medical College. We've been actually working with them for over 40 years, and most of it has been around infectious disease research, much of it funded by NIH and Fogarty, lots of student and faculty exchanges, and in the last 4 years we started moving into educational technology. CMC was starting to plan their new public health program. They were thinking of increasing their class size. They wanted to explore new educational methods, and they also have a large range of allied health programs, and they were also looking at expanding those. So we were fortunate to have some anonymous foundation funding, and that allowed us to start co-developing an infrastructure that they could build to support all of these different programs. So this is their homepage, and so as I mentioned, I don't have time to show you all of the things that are in there, but their faculty have been incredibly productive over the last 3 years and have created incredible libraries, histology libraries, anatomy, biochemistry. They've been incredibly creative with the content that they've created. And it's built on what's called Tufts University Science Knowledge Base, and it's open software that we started creating in 1994 with National Library of Medicine funding. And because it grew out of a library grant, actually it was a partnership with librarians, IT folks, and faculty, which I think is why I think we created it the right way from the very beginning. What we started to do was we've been training faculty from CMC. We have both gone to CMC and trained people on site, and then we also had funds to bring small groups of faculty to Boston, train faculty and staff. Each of the faculty came with a very specific curriculum project through an Innovations Grants program that they modeled on a similar program at Tufts. We then matched them to faculty at Tufts, and so the biochemist with the biochemist, surgery clerkship director with surgery clerkship director. so that they could start sharing content, sharing ideas, and sharing best practices. And here they are in our simulation lab having a lot of fun. They enjoyed that part of the trip. And then this is the cohort most recently, this past January. Susan Albright, who's the director of Tusk, and I were out there training another cohort. And this is year 3 of the grant, and one of the goals of the grant was not only to build the infrastructure at Christian Medical College, but also to enable it to disseminate this work across all of India. And so some of these faculty are from their secondary hospital network hospitals. Others are from local medical schools that were invited to participate. And we had predicted that this system would be self-sustainable in 5 years. And it's incredible. It's really a tribute to the dedication of these faculty. But the success of this was so obvious that their board elected to make it sustainable after 3 years. So it's now fully sustainable locally. It's really incredible. They have their own e-learning unit that's built out of the library. And here are a couple of their staff. Our approach was to train the trainers. And so the local staff have both the technical knowledge and the user support knowledge to customize everything, to do all the faculty training. So here are 2 of the 6 e-learning support staff. And during that training session, Susan and I, we were just sitting on the sidelines watching them do all the training. So it was really terrific to watch. So just wanted to give you a sense of how CMC is using this system. So CMC is the big star down on the bottom, the southeast corner of India. So it is the technical hub for this system. And so Tusk provides all of the learning management tools. So if you're familiar with Blackboard or Sakai or Moodle, it has all of those user tools. But in addition to that, it is a full content repository embedded with curriculum and knowledge management. So the faculty and deans can deliver, map, and monitor all of the curricula across all of their schools with one system. And CMC has a network of over 200 mission hospitals. And all of those faculty, all of those trainees, anywhere in the country can access this content. And actually, they can connect anywhere in the world if they have internet or cell phone access. So some of the hospitals are in extremely remote sites. They're fellows, which are medical graduates straight out of 5 years of medical school after high school, can be stationed at some of these sites without a faculty member. And last spring, we asked several of these fellows to volunteer to test mobile access. And we got half a dozen locally made phones with smartphone technology so that they could test connectivity, the cost of the data plans, and which applications were useful. The access actually was remarkably good, even in these really remote sites. Cell towers are everywhere. The local data plans actually were quite reasonable, and not surprisingly, the most popular application was the discussion tools, because here you have folks who are completely isolated, and they want to be able to discuss their cases with each other. So here's a quote from one of the fellows, being able to share photos. If they have a little iPhone type thing, they can snap a picture of a rash, send it off, what is this kind of thing. And so if you think of the system, what this enables you to do is all of these fellows stationed all over India can now download their cases onto the system, which is stored at the hub at CMC, building these case libraries that are site-specific. Everything is metadata tagged. Everything is searchable, everything is reusable, and so the faculty can now enhance those cases with learning materials that you pull off the web, other open educational resources, library resources, anything on the net, anything that was created by other CMC faculty, all can be brought together, stored on this repository, and then anyone who has access, via mobile, a laptop, or computer, can access that material. The next application we're working on is an interactive voice tool, because in India, there are several major languages, several hundred dialects. So it's really critical for local practitioners to be able to deliver patient materials in the local language. So we're very excited about that next tool. And if you're interested, we actually just published a journal article on this whole program, and happy to send you a copy if you'd like. It's in distance education. So I wanted to just very briefly explain a little bit more about what Tusk is. Let's see, the heart of this is a curriculum knowledge management system. So all of the content sits in a repository, so everything is saved. And then you have the web user interface. So it doesn't matter if you're using a computer, laptop, or cell phone, cell technology. It just depends on what kind of connection you have. And then there are import-export tools. So, if they're open educational resources like OpenCourseWare that comply with open content standards, you can just pull in any content from anywhere and then import it into this repository to be part of your Lego blocks to build your curriculum.